Are you having shoulder pains and don't know what to do or what's going on? As a retired pain management doctor, I have seen so many patients with shoulder pain next to back pain and knee pain. And most of these patients come to me after a failed surgery. Here, we will discuss why you're having pain in the shoulder joint. And in the next video, I have some exercises to share to help you relieve this shoulder pain and continue to function again. Shoulder pain in older adults is extremely common. Studies show that nearly 20 to 30% of adults over the age 60 report chronic shoulder pain. And when imaging is done, the numbers are even more striking. More than 50% of people over 70 have partial or full thickness rotator cuff tears, many without realizing it. This is not rare, this is common. But it is not simply old age. The most frequent causes are rotator cuff degeneration, subacromial impingement, osteoarthritis, and frozen shoulder. Let's talk about posture. Nowadays, we work on computers and phones and we stay with these devices all day and develop bad posture. As we age, the thoracic spine becomes more kyphotic. The head shifts forward. The shoulders round inward. This forward flex posture changes scapular mechanics. When the scapula tilts and protracts, the subacromial space narrows. That space is where the supraspinatus tendon and the subacromial bursa live. When that space narrows, the tendon gets compressed. Repeated compression leads to inflammation. Inflammation leads to degeneration. Degeneration leads to tears. This is what we call subacromial impingement. Biomechanical studies confirm that forward head posture and thoracic kyphosis reduce acromiohumeral distance. When the rotator cuff weakens, which naturally happens with sarcopenia, the humeral head migrates superiorly. That increases compression even more. It becomes a vicious cycle. Pain leads to less movement. Less movement leads to muscle atrophy. Muscle atrophy worsens joint mechanics and the impingement progresses. Why does it matter? Because shoulder function is directly tied to independence. Research shows shoulder pain significantly affects activities of daily living. Dressing, bathing, reaching overhead, grooming, carrying groceries. Night pain disrupts sleep, and poor sleep increases pain sensitivity. Older adults with chronic shoulder pain are more likely to reduce physical activity. Reduced physical activity accelerates deconditioning, and deconditioning increases fall risk. Remember, falls are very common in old age, and we have to prevent this. The shoulder is not just about lifting your arm. It is about protecting yourself when you stumble. It is about maintaining autonomy. Many patients say, "It's just aging." But longitudinal studies show targeted rehabilitation, especially postural correction, scapular stabilization, and rotator cuff strengthening improves pain and function even in people over 70. In the next video, I will share some exercises to help improve your posture and open up the subacromial space. I hope you will subscribe and stay with us. Please like and share. Thank you.